Endometriosis is a progressive condition, and it's really important to take women seriously, especially young women when they come with endometriosis and have period pain and they haven't yet got a diagnosis. Because this pain can be real, it can be serious, it can really cause a lot of anxiety and a lot of problems in terms of quality of a woman's life when every month she has debilitating pain. It's also important to safeguard her future fertility. And when we ignore signs of endometriosis at an early stage, that can really be detrimental to a woman's long-term fertility choices. What I would recommend is that if you do think you might have endometriosis, if you have really severe period pain and you're not trying to have a baby, it's a good idea to be checked out. One problem is that ultrasound diagnosis is inconsistent, and we can't always see severe endometriosis and we can't always see mild endometriosis on ultrasound. What I would suggest is that having a conversation about what can be done and considering both the medical and surgical elements of management of endometriosis can be really helpful. If we turn off endometriosis symptoms using medications, such as the oral contraceptive pill, that can actually protect a woman's fertility into the future because it prevents her endometriosis from progressing. And what that means is by the time that she does want to have a baby, she hasn't necessarily progressed to have scarring in her pelvis that's going to stop her from doing so. Endometriosis is a relative problem for fertility. It's not always a deal breaker. One thing that we know about endometriosis is that when we surgically manage endometriosis and help a patient to conceive naturally, the process of pregnancy is actually really great for her endometriosis. It suppresses it at the time, and sometimes it can even burn out. So it's not uncommon for women who have presented with endometriosis that's been managed surgically to go on to have more than one baby naturally.